The next natural remedy I'll discuss is called S-Adenosylmethionine, or SAMe. SAMe functions as a methyl donor. In the diagram, you can see the methyl group pointed to by the green arrow. This particular methyl group is very important in various physiologic processes, in particular neurotransmitter synthesis. SAMe levels are dependent on the vitamins folate and B12. We know that depression has been linked to deficiencies in these two vitamins. And as you can see in the diagram, it's possible that one of the results of folate or B12 deficiency may be reduction of SAMe. One advantage of using SAMe for depression is that it may bypass any MTHFR polymorphisms. MTHFR is the enzyme methylene tetrahydrofolate reductase, which is very important in the reaction shown in the diagram. A person with this deficiency may not be able to metabolize folate properly and thus result in lower levels of SAMe and hence in less synthesis of the neurotransmitters such as dopamine, serotonin, and acetylcholine, as well as others. So by giving SAMe, we continue to stimulate synthesis of these key neurotransmitters, and this may be how it exerts its antidepressant effect. SAMe, like St. John's wort, is also very well studied. There are more than 50 clinical trials published for SAMe in depression. And in these studies, SAMe has been administered orally, intramuscularly, or intravenously. And doses have ranged from 200 to 1600 milligrams a day, and more recently, doses even as high as 3200 milligrams a day. By and large, the studies support SAMe as more effective than placebo, and about equivalent in efficacy for depression as the tricyclic antidepressants. So far, there has only been one published comparison between SAMe and SSRIs. In this study, we recruited 189 people with depression, and for 12 weeks, they were treated with SAMe up to 3,200 milligrams a day, or escitalopram up to 20 milligrams a day, or a placebo. This was a double-blind, randomized controlled study. The results of this study showed no advantage for SAMe or for escitalopram over placebo. All the treatment arms improved about the same. So it's not clear from this study how much of SAMe's benefit might be due to a placebo effect. In 2004, Alpert and colleagues published an open study of SAMe in which it was given to 30 people who were not responding to SSRIs at doses between 800 and 1600 milligrams a day for 6 weeks, and the results were positive, showing efficacy. Papakostas and colleagues followed up this study in 2010. They recruited 73 individuals who were not responding to SSRIs or SNRIs, and for 6 weeks they were treated with SAMe 800 milligrams twice daily or placebo. This study found a significant advantage for SAMe. The recommended doses of SAMe based on the literature are between 400 and 3,200 milligrams a day. SAMe can be combined safely with other drugs since it doesn't have very many interactions. It has been combined with tricyclic antidepressants, serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors. SAMe appears to be a very safe drug. Most of the side effects reported tend to be mild. These include insomnia, loss of appetite or anorexia, constipation, nausea, dry mouth, sweating, dizziness, and anxiety. There have been cases of mania or hypomania developing in individuals with bipolar depression. These individuals should use SAMe carefully and preferably in combination with a mood stabilizer. What about in pregnant women? It has been shown that pregnancy actually decreases methylation activity and SAMe levels. So in theory, SAMe should be beneficial. There's one study done in pregnant women who were given SAMe for intrahepatic cholestasis, and results were positive. This suggests at least that SAMe is safe in pregnancy, but we need more studies to answer the question more conclusively. For now, we advise caution in pregnant women. One final consideration about SAMe is that it is among the more expensive of these natural remedies. A 400 milligram tablet may cost between 75 cents and $1.25. So for the individual who needs a very high dose, the cost could be quite substantial. I will now summarize some key points on SAMe. Overall, the evidence supports antidepressant efficacy as well as safety. SAMe can be used by itself as monotherapy or in combination with standard antidepressants. Unfortunately, the cost of SAMe may be prohibitive to some individuals.